Good morning. Welcome to today's presentation titled Law Enforcement's Role in Recovery. This webinar series is made possible by a grant award from SAMHSA, the Substance Abuse and Mental Health Services Administration. We are excited to provide this virtual series during the month of September, which is National Recovery Month. Please feel free to use the chat box to ask questions and add comments you have at any time throughout the webinar. And if time allows, we'll do our best to answer as many questions as we can at the end of the session. Our presenters today are Sergeant Nick Singleton and Officer Dwayne Hunger. Sergeant Nick Singleton has been with Clair County Sheriff's Office for 13 years. He is currently assigned to the Drug Task Force as a supervisor. He graduated from Grand Valley State University with a Bachelor's of Fine Arts in Criminal Justice. While working as a deputy, he was a field training officer, medical examiner, special investigator, clandestine drug laboratory responder, and was assigned to the Drug Task Force for 3 years. In 2015, he was qualified in the St. Clair County 31 District Court as an expert witness in local drug trends and trafficking. Officer Dwayne Hunger has been with Port Huron Police Department for 12 years and is the Community Services Officer. Prior to that, he was assigned to Road Patrol and the St. Clair County Drug Task Force. In his role as Community Services Officer, he works as liaison to the community members and businesses and manages the Port Huron Police Department social media pages. And with that, I'll turn it over to our presenters.
Thank you. I'm Sergeant Nick Singleton, and I'm going to talk to you today about the St. Clair County Sheriff's Office role in recovery. On this first slide, what I did is I put together a graph to show you just kind of what we've been seeing out at the Drug Task Force in the last 3 years. The far end, 2021, those are our statistics as far as the grams of those 3 narcotics seized through the end of June. The other 2 years are the entire calendar year. As you can see in 2021, we are still seeing quite a large amount of drugs. We're set to surpass what we saw in 2020 without question. The reason I chose to only list the 3 drugs is because just the wide array of things that we see, such as prescription pills and stuff, the chart would just get way too cluttered to even be able to follow. So as far as programs with the St. Clair County Sheriff's Office, we have programs both inside and outside of the intervention center. The majority of our programs do occur inside of the jail. However, our road patrol coordinates a lot out on the road through Central Dispatch. Without the partnerships that we have with organizations like Community Mental Health, Sacred Heart, various counselors, the Michigan Department of Corrections, and the Intervention Academy, among others, there's no way we'd be able to complete these programs. So a big thank you goes out to them. Inside of our jail, we have over 15 different programs that touch on substance abuse recovery occurring inside of our detention center. Throughout the course of this presentation, I'm going to touch on just a couple that have, I guess, are more focused on substance abuse recovery. One approach that we take with our programs in the jail is that we know all treatments work for some of the patients, but there's not one magical treatment that's going to work for every single patient. The reason we have so many programs is so that we can take all of those programs and focus on different needs for everybody. The first program I'm going to highlight is going to be the Residential Substance Abuse Treatment Program, or RSAT. This is one of our most popular programs, and by popular, I guess I should say it's our most intensive substance abuse program and probably one that gets the most publicity, for lack of a better description. RSAT is something that has to be court ordered. Somebody cannot walk into our jail and say, I want to be part of RSAT. It has to be a term of either a sentence or probation. It's completed in 3 separate phases. Each phase has a different timeline. There's several different ways that somebody can complete RSAT depending on what the sentencing guidelines are. So for example, somebody might have to complete all 3 phases of RSAT inside of our intervention center or our jail. They might complete phase 1 or phase 1 and 2 inside of our facility and then complete the remaining phases outside of our facility at the Huron House, or they could be sentenced to complete the entire program through an outside source such as the Huron House. As far as funding for RSAT, a portion of it is grant funded. Without the grant funding, it would have a much larger impact on our budget and we wouldn't be able to dedicate as much money as some of the other programs. On the right side of this slide, it shows the success rate. In 2020, we had an 88% success rate. 2019 was an 86%, and 2018 was a 90%. One thing about the success rate is that the way the success rate is tracked is the successful completion of the course. It doesn't necessarily track any sort of recidivism or anything like that. There are times where people do come through a second or even a third time through RSAT. As far as RSAP Phase One, what it does is it utilizes a cognitive behavioral treatment curriculum. The book's listed there. It's a new direction. It's 36 hours long. Inside of our jail, it's approximately 3 weeks. I believe the Huron House, when they run the first phase, it's a little bit longer. There's 3 separate books that are used: drug and alcohol education, criminal and addictive thinking, and relapse prevention. And 2/3 of the time is devoted to relapse prevention and critical thinking. Through Phase One, there's a lot of different coping skills that are taught. Some of those coping skills are time management, goal setting, cognitive behavioral therapy, breathing exercises, mindfulness, prayer and meditation, worst case scenarios, healthy habits, art therapy, refusal skills, and developing new hobbies. In RSAT Phase Two, it utilizes a separate curriculum, which is criminal conduct and substance abuse treatment, strategies for self-improvement and change, pathways to responsible living. This phase is 54 hours long. Inside of our jail, it's about 6 weeks long. Sometimes it stretches into 7. This phase is conducted in different group therapy sessions. The therapists that do facilitate these meetings are able to provide individual sessions if they determine that there's a need for the individual participants. A lot of what occurs in Phase Two towards the end is addressing just different aftercare plans, setting the participants up with resources such as support groups, outpatient counseling, things of that nature, so that they can aim for successful reentry into the community. RSAT Phase 3 focuses on individual case management. This is done in a one-on-one basis with an individual case manager, where they look at the participant's unique case to determine what they can do to aim for successful reentry into the community. A lot of it focuses on the aftercare plans once they're released, such as setting up recovery housing, arranging for rehab appointments, different employment opportunities, educational opportunities, providing bus passes, clothing, housing, things of that nature. Also, during this phase, a peer recovery counselor is provided. The next program is the medically assisted treatment program. This is a program that focuses on inmates coming into our facility that require some form of medical treatment to try and combat their substance abuse addiction. Through this program, there's 3 different medications that are provided. The first one is methadone. Methadone is usually provided at a short period of time and is prescribed by a doctor. The doctor comes in once a week, and normally what they'll do is they'll require some form of a detox period. The other 2 medications that are provided through this program is Suboxone and Vivitrol. This program is run in conjunction with Sacred Heart. Currently, we have 12 individuals enrolled in our detention center. 12 individuals is the maximum amount of people we can have enrolled in this program inside of our facility. So no one's added to this program until somebody either successfully passes or is kicked out of the program for one reason or another. Of those 12 individuals inside our facility, they try and keep it even. Currently, we have 6 males and 6 females enrolled in it. The purpose behind this program is to try and provide a treatment to a whole patient instead of just providing different mental support. By providing medication, sometimes it's able to help someone overcome their addiction for successful reentry into the community. Additionally, along with the doctor in this program, there is Sacred Heart therapists as well as a peer recovery coach that participates with the individual patient. The next program tends to be a favorite of a lot of people that work with any of the programs in our jail, and that's the peer recovery coach program. This program is contracted through the Michigan Department of Corrections. The workers through there have usually had some form of substance abuse addiction at some point and have successfully began their recovery. The benefit to this program is that it allows the recovery coach to bring a combination of their lived experience, hope, and state certifications into the program to talk to people. It's kind of like a success story type of program. They have presentations on what worked for them. The class is taught weekly, so these contractors will come into our intervention center once a week to meet with these people and tell them their story about what was going on in their life, what drugs they may have been addicted to, and how they were able to overcome them, what their driving forces were. That sometimes can reach a lot more people than just somebody standing up front who's never lived or walked a mile in the shoes of the person suffering from the substance abuse, because these people have. Another thing that they do is they set up different resources such as appointments and meeting schedules. Their main goal is to try and get people through on the right track versus having them leave our facility and go right back into the same environment or a situation with no report. Some of the different topics on their weekly teachings include how to deal with grief and recovery, different budgeting courses, how to fix your credit, resume building, life skills, multiple pathways to recovery, the 12-step program, different goal setting, how to establish boundaries, as well as some meditation exercises. Some of the other programs and resources that we do have inside our facility are listed here. All of them do not necessarily touch on substance abuse the entire time. However, it is part of the curriculum. The first one is the Intervention Academy. For those of you not familiar, the Intervention Academy is a chartered school that teaches courses through our intervention center. Throughout their curriculum, sometimes they focus on just different substance abuse issues. Alcohol and drug education is it's offered weekly. It's open to both men and women, and they're 90-minute groups. RSAT participants, the program I talked about earlier, are not allowed into this program. They strictly do RSAT. Alcohol recovery program is done through the Center for Human Resources. It's an 8-week program, and it's offered weekly also for men and women. The Skills for Effective Living is offered through Catholic Social Services. Through this course, they learn how to cope, different skills in coping, self-esteem, time management, goal setting, relationships, and communication. It's an 8-week program, and it's offered weekly for an hour and a half long. The Domestic Violence Intervention Program is a 16-week intervention course designed to stop family violence. It's only offered for men inside of our facility, and it is offered to those who have a history of being charged with domestic violence or have a history of committing violence in the family. A portion of that course does cover the role of substance abuse sometimes in those domestic violence situations. Anger management is an 8-week program. It's offered weekly to both males and females. That program you do not have to be court ordered for. However, if there is a court ordered individual, they receive priority into that course. It is not offered outside of our intervention center in the community. The parenting course is an 8-week program offered to males and females. It was developed to meet the Department of Human Services guidelines addressing different issues such as abuse, neglect, discipline, and other parenting issues. Again, they also cover a portion in there about substance abuse and how it can affect different parenting. The Women's Trauma Group is run through Sacred Heart Rehabilitation Center. It's 6 sessions long, and it's an educational program that uses seeking safety format to provide information on how to move on after experiencing trauma. The Men's PTSD Group, that's also through Sacred Heart Rehabilitation Center. It's 8 sessions long, provides different support for men suffering from PTSD. Additional aspect of that is they focus on how turning to substance abuse could have extremely negative impacts. Alcoholics Anonymous and Narcotics Anonymous, as well as the 12-step orientation, that is done through community volunteers and peers that are currently in recovery. The meetings are available to any inmates except for the maximum security inmates back in our intervention center. And currently there's 15 different Alcoholics Anonymous or Narcotics Anonymous meetings for that inmates can attend per week. The mental health services, that just focuses on ongoing mental health services for active clients to community mental health. It provides screenings at the request of the intervention center staff for people who may not be a client of community mental health. The trauma recovery empowerment model, that's also done through CMH. It's a 26 session group for women who have co-occurring mental health and substance abuse disorder issues. All participation in that must be approved through CMH. Additionally, on there listed is the Rehabilitation Library. That's not necessarily a program, it's just a resource that's available to the inmates of the intervention center. What that is it's all sorts of literature, books, things of that nature on substance abuse and its recovery. The young lady at our office who's in charge of that, Ms. DeMoss, I spoke with her and she told me that it has all sorts of literature in there. And if inmates ever bring up something that they want to see that's not in there, they just go out and get it and add it to the collection. The final program is Hope Not Handcuffs. For those of you not familiar with Hope Not Handcuffs, it's a program that was launched several years ago that if somebody is suffering from some sort of substance abuse issue or needs help, they can walk into our office or in St. Clair County, any office that has to do with law enforcement, explain their issue, and we'll set them up with the help that they need. That happens more on the road patrol side than the intervention center. And we don't track statistics for that because it just doesn't really seem proper. It's just something that's always out there and open to the community. A couple of the newer and upcoming programs. The first one I want to talk about was the St. Clair County Intervention Academy Recovery High School. This is open to students grades 9 through 12, and it's a program for them. It's a full high school curriculum. It's set for them to participate in before and after school activities besides the curriculum, as well as weekend field trips. The entire purpose of this program being launched was to attempt to make sure that some teenagers and high schoolers who may be developing substance abuse issues don't fall through the cracks to where down the road they've already had the issue for several years unaddressed. The school does provide a laptop and all the supplies for the students free of charge. It does have a 20 student limit. That program, there's more information online. I know there's a Times Herald article done that's run through the Intervention Academy, who also teaches all of our classes. We don't necessarily have a direct hand in that other than through our juvenile center, maybe locating some different participants that would be good candidates. The next program would be the Naloxone hydrochloride distribution. There was talk at our office of providing Narcan, actual Narcan, to inmates with substance abuse issues as they left. There was talk of handing out Narcan directly at our lobby. Our office has decided that rather than take on another responsibility as far as issuing the Narcan when there's already fail-safe set up through community mental health, the route that we're taking with the inmates with substance abuse issues is to make sure that they're provided with all the different information and resources as far as how to obtain Narcan if they feel that's necessary for them. All this information is loaded onto our jail tablet system. For anyone that's not aware, back in our intervention center, the inmates do have access to tablets where they can do various activities. There's obviously information and resources added to that, and Narcan was just recently added to that system, advising them how to get it. The whole purpose behind this, it was driven by the recognition that Narcan has saved numerous lives. It saved people with substance abuse lives. It saved police officers, other community members who have had an accidental exposure to something. Also, they had 2 of the medically assisted treatment patients a while back that successfully completed the program, were released from our facility, and within days of the release, they both overdosed. One of those people that overdosed did pass away. The other one was placed on a ventilator. At our office, we recognize that there's most likely always going to be some sort of need for improved training and assisting in recovery, and the Sinclair County Sheriff's Office is definitely no exception to that. At this point, does anyone have any questions for me?
It doesn't look like we have any in the chat right now, but if anyone thinks of things during the remainder of the presentation, we can definitely revisit Q&A at the end. All right, so are you ready to turn it over to Officer Hunger?
I am. It's all yours, Dwayne.
All right, everybody got me?
Yep.
Okay. Okay, I am Officer Dwayne Hunger. I'm the Community Services Officer for the Clair County Police Department. Like was mentioned, I am the liaison officer for the community. So I work a lot with the community and with different members of the community. I work with CMH, I work with Odyssey House, I work with a bunch of different rehab facilities and businesses in town. So in late 2020, myself and Chief Platzer, we approached the Port Huron Housing Commission and to talk to them about possibly using one of their offices down in the south end of Port Huron, down 2529 Manual Street, the Huron Village housing complex. They were more than open and allow us to use one of their offices. In early 2021, we opened up a second one up in Gratiot Village at 1509 Riverview. That was their community center. We have an office up there. Inside there, the officers have used them for interviews. If someone's not comfortable being interviewed in a house, possibly a victim of something, the officers are able to interview them right at one of our outreach centers. It's also a place where we have zone officers throughout. We have 18 different zones throughout the city we break them up into. It's also a place where a citizen or neighborhood watch committee can meet the officers and voice any concerns or ask any questions that we have of them. Inside the outreach centers, I've met with Adrienne from CMH, and we have a lot of information pamphlets. We have some from the Odyssey House in there. So things that they can use for veterans. In 2021, in I believe the spring, we wrote a grant through the Community Foundation. And through the Community Foundation, we received the grant for $4,000 to purchase personal hygiene products and clothing. So what happens is our officers while out on the street run into somebody who is homeless or is just in need, a family member who just needs a helping hand. We have those products and those items right on hand. We've gone to the Port of Hopes and we've passed items out when we've run into somebody that is in need over there. So it's a process. We're still trying to figure out how we can get more of that stuff out because we have so much. I mean, we have from sunscreen to socks to t-shirts, shampoos, all different types of items that our officers can hand out to them. Our school resource officers have used them also with people that they've run into. Some of the training that we've done over the last year, we received mental health first aid training. Every employee at the Port Huron Police Department, from our records division, our cadets, through the chief of police, all received mental health first aid training through CMH. And just a quick story. The next day, after two of our officers, within hours of each other, they ran into two separate subjects that were wandering around, talking to themselves, looking around. So the training assisted the officers in being able to see that it wasn't a drug use or an addiction issue that the person was having, that they weren't high on drugs, that it was a schizophrenia that they were dealing with. So our mental health first aid training came in handy literally the next day that we received the training. We also run a youth academy once a year, a 5-day academy where 9th through 12th graders from anywhere in the county, they can come and sign up through our department. Everything is paid for through grants. They receive uniforms, and our officers train them through different, it's a 16-week police academy condensed down to 1 5-week program. But this year, in working with the Odyssey House, I had a recovery coach, Kim, come in and speak to the class for approximately an hour. And Kim was able to show them a success story. I know they see a lot in the news and things like that, and that being young, they may not have met somebody or talked to somebody that has had a drug abuse problem. With Kim being able to go in there, if you guys know Kim from Odyssey, one of the recovery coaches, if she didn't tell you, you would never know that she had previously used drugs. So it helped them see a different side of it other than what they're just seeing or hearing on TV. Also, we have a Citizens Police Academy. It actually just started last night. And during that is a 7-week program. We meet 3 hours every Wednesday night. And we always have members of our detective bureau and also of, we have 2 members out at underneath Nick Singleton out at the drug task force that we have come in and talk to a couple hours and teach the community and teach our academy classmates that what the drug task force does, like Nick had said, what the trends they're seeing, the drugs that we're seeing out there. We also have 2 school resource officers that are at the high schools, and the school resource officers, they're available to their students at all times, Officer Lori Phillips and Officer Dennis Heisman. So any students that we're not seeing a lot with the students having drug issues and drug use issues other than vape pens. But a lot what we're seeing is being there for them and getting them resources because a family member, an older brother, sister, sibling, mom, dad, aunt, uncle, even grandparents that may have drug issues, our school resource officers are a resource for them to assist them if they're not comfortable going to one of the school administrators or their school counselors. They can come to the officers, and the officers can then guide them to get some assistance. 2020, we were approached by Ken Jones and Ken Hooveman from the Odyssey House to start up a program called MORT, the Mobile Overdose Response Team. It took a little while. If Ken will, I'm sure, agree with me if he's out there listening, that dealing with the lawyers and confidentiality and things like that, it took longer than what we would have liked to have seen to get it started, but we are started. It's a grant that the Odyssey House received, and they brought us along with it because most of the overdoses in the county occur within the city of Port Huron. So it started in April of 2021. We work in conjunction with the Odyssey House. I go out as an officer with a recovery coach to make contact with somebody. So our road patrol officers, they go on an overdose call. And on that overdose call, Odyssey House provided us with what we deem MORT cards with Odyssey House's information on it, their address, phone number, and that's all that's on there. Whether the person is awake and conscious or whether we're able to actually speak with them, we give them this card, whether we place it in their purse, in their pocket, coat pocket, whatever, so that when they are able to leave the hospital, they see that that information is there and they call and they can hopefully get some resources. So, and speaking with Ken Hooverman, Ken's, he is the numbers guy. He knows the stats, but within 72 hours, that is the goal. Within 72 hours of our officers, road patrol officers, going on an overdose, myself and a recovery coach are going to their residence or the place that they overdosed at, and we're knocking on their door and we are offering them services. We have a booklet with information from all the rehab services that are in St. Clair County and outside of the county. We're also working with, right now, I just spoke with Adrian yesterday to work on getting information together, because what we have seen is the people, our officers don't know all the time when someone overdoses and they pass away. So we've gone to some of these houses to make contact with this person who has overdosed, and found out when we got there talking to a family member that the person has passed. So I'm working with Adrian to get some information packets on grief counseling for these people, whether it's Pollock, Randall, CMH, or whoever, to try and help these families out also. So I go out 2 days a week, every Tuesday and Thursday, for as many hours as it takes. I go out in plain clothes to try and bring them at ease. A lot of the, and Nick will confirm with me that a lot of times when we deal with people, they're not trusting in the police because they've only ever had a bad experience. So I go out there without the uniform on, with just my duty belt and a polo and some khakis, to try and break that ice with them. But our recovery coach will go up and make contact with them, speak with them, offer them services, and see if they will sign up for services. They can sign up right then and there. And whether it's inpatient, outpatient, Odyssey House will make that call on whether they can get them into somewhere. It doesn't matter where they want to go. If they want to go CMH, Sacred Heart, Vision Quest, Odyssey House, doesn't matter. The goal is just to get people to stop dying. I'll show you later. I have some slides on our stats, and I think you'll be a little, it's frightening how bad it's gotten just in 2021. So what happens if they do sign up, Odyssey House then takes over. So once the person decides whether they want to allow Odyssey House to speak with me in reference to it, if they don't want to sign up or sign off on that confidentiality, they don't have to. So they're then turned over to the Odyssey House for any follow-up aftercare, things like that. Odyssey House also in that grant it's pretty much an endless supply of Narcan. Some of the success stories that we've had with the Narcan passing out, there was a female in town, she's overdosed 3 times, same address. The second time after she'd overdosed, we finally were able to make contact with her on a Thursday. We gave her 4 doses of Narcan. All 4 doses were used on her that Friday night. She overdosed the very next night. So just getting that out there to try, and we're just trying to save people's lives. As you can see, some of the stats here, this is from starting through, September 6th. So there are a few here in September that I don't have on here, but so far this year through September 6th, we have had 93 overdoses in the city of Port Huron. The Port Huron Police Department has been called. We don't always get called on all of them. Tri-Hospital EMS has, I'm sure, been called on a lot more. The Sheriff Department and other municipality police departments throughout the county. But in just Port Huron alone, our police department has been called and had 93 overdoses. Some of those 93, it's not 93 people, it's 93 occurrences of an overdose call. So there are, like I said, we have one gentleman who was homeless that is overdosed, I believe, I want to say 5 times this year that we've been called on. Just some of the numbers going back to 2017. 2017, we didn't start until July of that year in keeping track of them. What you've seen in the 2015, 16, 17 time range is you've seen fentanyl come into town, and that's when it became a big issue. And with my 3 years out the drug task force, and I'm sure Nick would agree, heroin, they're calling it heroin. It's not. Normally, it's not. Almost every time it is a fentanyl. It is some type of fentanyl that is mixed in with another substance that these people are taking and overdosing on. So we started it there. And as you can see, our numbers have gone up in 2021. And I'm sounding like and talking to them, some of the reasonings on that is just one, the whole COVID thing, but also people have extra money from COVID. So you're seeing that also where they have the money to spend. So this is another slide that just kind of shows the months. Our age groups, as you can see, 25 to 44. So 62 out of our 93 are within that age range. We did have an older gentleman, 66 years old. We went and spoke with him to offer him services. He says, I'm 66 years old. What does it matter? I'm 66 years old. I'm going to die anyway. We explained to him that it does matter. He wouldn't sign up for services, but we were able to provide him Narcan in the information packet. So he may not feel like that today, but the information packet, whether it sits on their table or desk, wherever in their house, it could be a month from now, a year from now. At some point, they are probably going to get to a point in their life where they decide that they need help, and they don't have far to look now because that information is sitting at least right in front of them. They don't have to come in somewhere and ask for assistance. We also work Hope Not Handcuffs. It's a great program. I agree with it 100%. But this is just another way, instead of waiting for them to come in and walk into our door and state that they need assistance, we are going out and knocking on their door, telling them you need assistance, and here's how you can get that information. Ken was able to plot an interactive map. This is just a snapshot of it, but what it does is it shows where our overdoses and what type of overdoses are occurring. As you can see here, our opiates, it's named just opiates because some of them may be another type of opiate, whether it's fentanyl, heroin, we don't know, but it's definitely an opiate. And then we have our pills in green, and then our stimulants, cocaine and things like that in yellow and blue here. So you can also see Ken was able to put where a lot of our deaths have occurred. So as you can see, there's a big spot north of Griswold Street, if you're familiar with the city of Port Huron, and south of the Black River, east of, say, 16th or 13th Street, and then to the water to Military Street. So that is where a lot of our overdoses are occurring in the city. So what do we do to help combat that? Well, after we've made contact with everyone that is on our list to make contact with that day, we start driving around the street. Me working out at the county drug task force, I recognize people. I went out with Alicia, another one of the recovery coaches, 2 weeks ago, I believe it was, and a gentleman I recognized from being out there, knowing that he has a drug abuse problem. We stopped and we spoke with him. He immediately broke down and started crying, standing on the sidewalk, and stated that he couldn't believe that somebody cares. So we're just trying to get that information out. We're hoping that it spreads by street word, that the Odyssey House, the Port Huron Police Department, that these drug rehab facilities do not want you to die, that we do care and we want you to get assistance. And it's nice having Alicia and Kim there, like Nick said, with their recovery coaches. They're been there, done that, and they're not going to listen to the quote unquote BS from the users on why they're not getting the help that they need, because they've been there. So the map does help us. And so it helps us show us our quote unquote hot spots on where we need to go. But as you can see, it does not matter where you live. You can live up in the north end of Port Huron, up by the water, or you can live in a rental in the 900 block of Pine Street. It does not matter. If you're addicted to drugs, it does not matter how much money you make or where you live, the drug does not care. And as you can see, we've had, I believe, one since I made this slide from September 6th. We are at 10 or 11 overdoses this year alone. One of the issues that we have seen with not having addresses for people are the homeless population. We're seeing a lot of them. I actually have my list sitting right next to me because after I leave here, I'm getting a hold of Ken and we're going out. Is that our homeless population, they're hard to find. So I talked to Alicia and I talked to Kim about it, and they went out. If everyone knows what Tent City is, or Tent Village, whatever you'd like to call it, in behind the old Super K and in behind Kroger on 24th Street. They went out there in the woods and in the weeds and passed out Narcan and passed out information packets to try and get people assistance. So we're seeing a lot of our homeless. There are a lot of the majority, I would say, of our multiple overdoses from a single person are from our homeless population. So I was working with Alice Reeves from the Soup Kitchen up at Kroger on a food drive, and I was talking to Alice about it. And she said that she would love to get involved and help pass out information, or possibly when they have their new building, get somebody inside there to get information out to these people, that there are services out there if they need them. And it just so happened, not even joking, 20 minutes later, in walks Ken Hooverman from the Odyssey House. So they're in the process of working together to try and get information out to our homeless population. So that is the end of my slide. If you guys have any questions or you need information, there's my information there. I just want to say that I know what the Sheriff Department does out of the Drug Task Force. I know that the work that they do. So we are trying and we are giving it a valiant effort. We are starting new programs like Sergeant Singleton said. But one of the things that we did notice in working with Odyssey House and going out to these places is we're gaining information. We gained information. We had 6 or 7 of our overdoses that we found were a pressed fentanyl pill. They were all Percocet, 30 milligram Percocets, or what the street would call a Roxy. And we were able then to pass that information on to the Drug Task Force. And this is what we're seeing. This is what we're hearing. In talking to one of our members, a couple weeks later after passing on that information, or maybe it was a month later, they were able to nab somebody with 4,000 pills on them. So we're seeing the success, but we are doing our best, I can promise you that.
All right, I've got a couple questions I want to read out to you guys, and it can be either or both could answer. But one of the questions was, and Dwayne, you touched on this a little bit, but what are some of the trends or changes that you're seeing with youth populations? And maybe each of you can kind of speak to your experience a little bit.
I apologize. I'm in the process of shutting my screen down. What population?
With youth populations, what kind of trends or changes are you guys seeing in your field, in your scope with our younger population?
Well, going out and we have our dates. I'm actually looking at one right here of somebody who was overdosed. And it was we're seeing a lot of our youth. It's not being listed in the reports, or it's prescription pills. If they're overdosing it, it seems to be what we're seeing is prescription pills, 17, 18, 19 years old. So in speaking with our school resource officers, we're finding the vape pens are out of control. I mean, literally out of control. I know it's not one of the part of illegal drugs that we would deal with as police officers out on the street, but vapes are huge in the schools right now. And with our school resource officers being able to assist them, with family members and things like that that have possibly overdosed. So mainly getting that information out to them. And I don't know if Nick has anything else that he can add to that.
Well, I would agree with what Dwayne said. I guess so my first stint out at the drug task force was 2012, 2015. They recently went back out there in January. And I guess the big difference with youth between then and now for me is it seems like they are a lot more involved in pills and opiate pills, like Dwayne was saying. We with the vape pens, I had no doubt those are out of control. That's not necessarily something drug task force deals directly with, but it seems like they're going into, I guess, what we would classify as harder drugs versus the last time I was out here, you'd catch, teenagers with marijuana or something like that. And that was always, people would say that that was the gateway drug. That was what was getting them. Now what it is people are already there. The younger folks are already there, which I think was a big driving force behind the development of the recovery high school.
Okay, and then someone wanted to know, with the Hope Not Handcuffs program, about how many contacts with people kind of in a year, or how many people have made the choice to go to treatment via that program?
I don't know if Dwayne has specific numbers. I know that I don't. Part of the reason behind that is because it's a 24/7 service that we have. All of our officers, our road patrol supervisors, everybody knows that if someone walks in the door, they have the resources set up to get them in touch with Sacred Heart or whatever organization would be appropriate. We don't track after that. And part of the reason behind our stance on that is we don't want people to be uncomfortable thinking that we're tracking what's happening with them after. So I can't speak for Dwayne or Port Huron, but I know my office, we don't really track those numbers, so I don't have an answer.
Yeah, it's the same thing at the Port Huron Police Department. A lot of it falls on confidentiality. Someone comes in asking for help, we're just that contact person for them. We will contact one of the angels to take them to the rehab service that they prefer to use, or if they don't care, we'll find one for them. But a lot of times we're not getting their names. We're not asking them what their drug of choice was or anything like that. Mainly it's, you need medical attention. Do you need assistance? When have you last used? Because we're concerned for their safety. We don't want them, quote unquote, falling out or overdosing in our lobby. So we're offer them medical assistance. But after that, it's contacting Hope Not Handcuffs, one of the angels, to get them the service, whether it's FAN through the Families Against Narcotics or whoever, to get them the assistance that they need.
Okay, and then this question is maybe a little bit more on the enforcement end of things, but it was, any suggestions to the community if we suspect someone is dealing or using and people want to report it?
Yeah, I know my office, we get reports, multiple reports daily of people saying that they think there's drug activity here or at a neighbor's house or things of that nature. They provide names. Every single time that we get a call, that is followed up on. I know sometimes some people get frustrated. They think that we don't follow up on things. We do. Unfortunately, and I know Dwayne can attest to this from his time out there, unfortunately, the way that narcotics trafficking works and the covert style, sometimes it takes a lot of time. And some of my happiest moments are when we get those calls, and it might take a month, it might take 6 months, but we're finally able to bring some form of closure to that. And the original people that called are ecstatic. Now, I'd be sitting here lying to you if I said every single time we get a call, we're able to close out that case. We're not perfect. We do our absolute best. I have a great crew working with me. I wish every day Dwayne was still out there, but he had to move on. So we do follow up on every call. You can reach the drug task force. We have a 1-800 number or 985-8201 or ring rate to us. If nobody answers the phone, leave a message, because those messages do get followed up on. If you do call, the only thing I would stress is that if you want us to contact you back, please leave a name and number. Even if you say you want to be anonymous, but you want to talk to us and give us more information than what you're leaving on a message, leave a name and number, because we will call you back. Everybody that's on my group knows that if they get a message, they will call that person back.
And with Port Huron Police Department, we have an app called Tip 411 that people can do it right from their phone. So you can go right on our website or on our Facebook page to leave a tip. You click on leave a tip. It can be completely anonymous, but once that tip is sent, every officer throughout our whole department, including our members out of Drug Task Force, get that information and they through their email, their work email. So, and Nick's right, we always followed up on them. And most people don't know, you may think it's insignificant, but when we're writing a search warrant, we can use that information from a neighbor that states a lot of traffic coming in and out of this house, or, you know, the smells that they're smelling. That information can be used for more than just letting us know that that person might be using or selling, but also on us, our investigation to get a search warrant to enter that residence and things like that.
All right. And then I just have one here, and it's probably not something that you guys can answer. But I had a service provider in the chat here talking about how she's seeing that people are having a hard time finding housing, wondering if there's any relief in the future with housing problems. A lot of other things co-occur, including substance use disorder. I know you talked a little bit about working with Alice Reeves. Are you working with any of our other housing and homelessness service providers in the area? And in what ways are you guys kind of partnering on that issue?
I know we stopped at Be Warm on 24th. We've stopped at 511 Union Street, Pathway Shelter. So we have stopped there. We've offered them services and information to assist these people. We also have, I know the city works with the Port Huron Landlord Association. There's information in there for housing also, I believe. So do I know all the information? No, a lot of that's above my head and above my pay grade, but on our level as a part of mobile overdose response team, we have gone out and made contact with these shelters to offer them. Ken and his team will offer them Narcan training and Narcan to assist them, and so that they have Narcan on hand at their shelters.
As far as the drug task force role in that, we don't really have a whole lot to do with housing. Speaking from times previous when I was a deputy, a lot of, you know, if we find someone with a housing issue, we try and get them a safe, warm spot to stay at, such as one of the shelters who can provide them with further assistance in trying to obtain housing. But we don't directly have anything with housing, so I don't know if there is any relief in the future.
All right. Well, thank you both so much for taking the time to be with us today, taking time out of your busy schedule. We know you guys are handling a lot of different things in a day. So thank you for that. And thanks to everyone who has joined us for this session. Today's presentation is one of many webinars scheduled throughout the month of September, which is National Recovery Month. You can still register for any upcoming presentations on our website at sccmh.org. At the conclusion of this webinar, a survey will pop up. Please fill this out, especially if you have requested continuing education credits. Thanks again for joining us today, and we look forward to seeing you all next time.